to welcome you to Reimagining Frontline Care, the Power of Research, Artificial Intelligence, and Innovation. Before I actually dive into our overview today, I wanted to welcome you also to the city of Houston. And there's a couple of great things about the city of Houston. Number one is it comes with some great barbecue. And for those of you who haven't tried it, it is really quite remarkable. Number two, it is also a place where there's a lot of great people. And so I want to start off, and I'm actually going to ask Hanjie Zhang to come up on stage one more time to talk about how AI and nutrition actually come together. So for that, we're going to go through a short exercise. And once again, if you have not met Hanjie Zhang, she leads our Innovation AI Hub activities within Renal Research Institute. So Hanjie, please.
Hi, everyone. See, this is a really nice barbecue pictures. That make I want to actually eat barbecue right now. You can start, yeah. Okay, so this is our AI tool for meal planning. So it is perfect fit to what you are exactly asking by natural language. So maybe you can start, yeah, sorry. Okay, so look at the picture. I want to eat barbecue, but I know my dietitian and my doctor always told me to be low on sodium. So I'm going to limit myself to barbecue with sodium less than 500 milligrams. Okay, then click on the submit. Then we will see the AI tool gives us. So it currently takes about 10 seconds to 15 seconds. And then it will, yeah, now it's here. Okay, so if you're scrolling down, you will see a lot of options about the barbecue. All these recipes are coming from valid source. These are kidney-friendly meals from valid website. So if we go back to maybe the first one, if you see the barbecue beef, if you click on it, and you can see, oh, sodium is only 77 milligrams, and also high in protein, 16 grams. And all the other things, potassium, calcium, all looks pretty good. So if I'm a dialysis patient, I'm probably going to go with this one. Okay, so this is when you know what you want to eat. So here, I want to eat barbecue. Let's try another example. Oh, maybe before the other example, sorry. So if you click on the barbecue beef, so this tool, we only use the valid source. So every time when you click on it, it will go to the original source, where it did come from. If you go down on the page, you have the detailed ingredient, instructions, nutrition fact. So if you're interested in this meal, you can cook it based on all the detailed instructions. And everything's original sources. So this would not have the hallucination we were talking about earlier, because this is all based on the fact. Okay, then let's go to try another example. Let's say I don't know what I'm going to eat today, but I'm in this amazing Houston. I will say, okay, I'm at Houston. What should I eat? Eat. Yeah. Okay, submit, and let's see. It takes 10 to 15 seconds. This is, we don't know what will come out. So this is the every time when it's generated, you never know what is going to come out for you. Okay, let's see the result. Okay, so it says, okay, here are some kidney-friendly dishes by the Houston Tex-Mex flavors. So it gives me some options. Textile chili, fajitas, grilled chicken. And also here, it says, okay, if we want to try all four in today, it sums the calories, protein, sodium, and all these things. I'm probably going to eat all four of them, because it looks like they're really good in protein, and sodium is on the borderline of 2,000, which is fine. It looks good to me. And then if you're going down, then you will see, beside these options, there is many other options. And same here, if you click on any photo, yeah, you will be able to see the detailed nutrition fact. So the main reason we developed this tool is we feel like no matter for CKD patient or ESRD patient, you already give up a lot for your life. And the last thing you don't want to give up is the joy and flavor when you eat. So we want the patient to have more choice and smart planning and more engaging. Yeah, thank you.
Thank you so much for this overview, and this seems very appropriate given that we're all actually eating food. So I want to ask a couple of questions. This is going to be audience participation. So I think my first question, based on what you've seen, by show of hands, how many of you think AI could actually prepare meals for our patients in an appropriate way, and they would do it pretty well? All right, around 50, 60%, all right. And then how many of you think it would not work so well? Nobody says no. Wow. All right. Well, let's now talk a little about artificial intelligence and statistics, and also why did we want to have this particular symposium here today? So I think at the end of the day, most of us would probably agree, and I want to thank Karan and Hanjie, because you couldn't have set the stage better. AI is not always right, and statistics is not always right. And we have to always have the oversight and critical thinking when we use technology, when we use artificial intelligence and other tools. So I'm going to show you a couple of different graphs. Some of you are pretty familiar with them, others have not seen this. This is all real data, I can assure you. So the very first graph that you see on the screen is the ice cream production and homicide incident rate by month. And as you could see, I don't think you have to be a statistician to see that there's almost a perfect correlation. The higher is the ice cream production, the higher is the homicide incidence in the United States. Once again, real data. Let's look at a couple of other examples. The next one is the other global temperatures and the estimated number of pirates. Once again, real data. This is by year, and there is almost a perfect negative correlation between those two numbers. Correlation does not certainly causation. And let's just go through a couple of examples. The next one is Nicolas Cage films released and the number of drownings in pools in the United States by year. Once again, a pretty perfect linear correlation, I would argue, positive correlation. And just one more example, I promise. And the very last example, and I'm actually shocked somebody has these statistics, but it's the US cheese consumption versus the number of deaths in the United States from tangled bed sheets. It is real data, and yes, somebody is keeping track of those statistics. So what you could see on all these plots is it seems like there's pretty perfect correlations, but does not mean causation. And so what does this really all mean to us? That critical thinking really matters, whether you use AI, whether you use statistics, or you use technology in general. And so at the end of the day, I think AI can help. And once again, thank you, Karan and Hanjie, because you really set the perfect stage there. But we need people like you to actually guide it ahead. And so I think we all know that no technology, no AI, and based on this, nothing can substitute the human touch, and nothing can substitute the critical thinking. And this is the reason why dietitians, social workers, nurses, PCTs, pharmacists, and many others who are providing care to our patients, irrespective of the settings, are so important. It's the human side of healthcare. It's the human heart of healthcare itself. But in reality, only a small number of them are actually involved in research. Only a small number of clinical staff, in my mind, I think, are actually involved in innovation and research. And that is really the reason why we wanted to have this symposium today, that we can hear voices from our clinical staff, irrespective of the setting that they may be in. And so just to walk you through the agenda really briefly, we obviously started about an hour ago by an outstanding presentation and hands-on training by Hanjie and Karan. We will then turn it over to Lisa Pacelli after me to talk about her journey, a fascinating journey from being a technician to being a researcher now and being a manager and many other heads that I think she's worn over the years. We'll then have a few discussion panels, and I wanted to have different angles for these discussions in the first half of the meeting. So first, we're going to start from a perspective from a large dialysis organization. So we'll have Tricia and Morielka from Fresenius Medical Care, both from the US and from a non-US side of Fresenius Medical Care, talk about their perspective of how to engage clinicians more. This will be moderated by somebody you know very well, Peter Kotenko. Then the next few panels will look at different aspects, and in this case, the next one will be by Mayo Clinic, and so we'll have Wisset and Rachel give us a perspective from a Mayo Clinic, an academic center perspective. We'll then talk about perspectives from professional societies and academia, and so we'll have Faith Lynch and Annabelle Burette. Faith, of course, is the president of AANA, and Annabelle is with Purdue University. So looking at how does academia look at this type of education and involving our clinicians into these topics. And then we'll conclude the first half of this meeting with very interesting discussions from journeys that clinicians can take. And so we'll have Zhao and Amber from Virginia Commonwealth University. Zhao is from Fresenius, Portugal. He is the director of nursing. We'll have Jacob Bentz, who is a technician in one of our dialysis clinics in Indianapolis, I believe. And that will be moderated by Osama El-Shami. And then finally, we'll conclude a day with a few actual presentations. They're pretty short, 15-minute presentations, where technology and AI can, in fact, help our clinicians do things better and help them in a way. And so we'll have presentations from a social worker perspective by Felicia Speed, from Linda Moore on the dietitian perspective on precision nutrition-related topics. We'll also have a presentation by Adrian Gomez, Nurse as an Innovator. Both this and the second half will be moderated by Luca Neri from Renal Research Institute. There will be a little bit of time for questions at the very end, so I think if you have any questions, please make sure to pass them along. And then the very last three presentations will be, one will be by Angela Shippey from Amazon Web Services. The next presentation will be Lawrence Coman from AVOMD, and then we'll conclude with a presentation from Dr. Blood from Brigham and Women's Hospital, looking at how algorithms can help our pharmacists. And once again, even though it says Anka Winter, unfortunately she got sick, so she wasn't able to make it here, so Luca Neri will moderate both. And so in the very conclusion, before I introduce Lisa, just when I think about what do I want to get out of today and what I hope you will get out of today, I think it's probably these 5 different things. First, it's really to empower our frontline clinicians to co-create and to lead innovation. Number 2, it's to recognize that real transformation starts with those who care for patients on a daily basis. Number 3, it's to encourage clinician-led research and publication-related activities. Number 4, it's to use AI and digital tools to enhance and, very importantly, not replace the human side of care. And then finally, it's to share some practical examples of what others are doing in this field. And while I don't have a bullet point for this, I do think all these meetings and symposia, part of it is about collaboration. It's about meeting people. It's about engaging in meaningful conversations with each other.